Today, over the last 24 hours, we have identified 1,685 additional cases of COVID-19. Yesterday, we completed more than 18,000 new tests in Alberta, which means that our provincial positivity rate has risen to 9.2%. As you heard, sadly, there were 10 deaths related to COVID-19 reported to us in the last 24 hours. My sympathies are with all the loved ones of these individuals and those who have passed away from any other cause. In schools, there are currently active alerts or outbreaks in 397 schools, about 17% of all the schools in Alberta. Currently, these schools have a combined total of 1,537 active cases. This number includes 210 schools with outbreaks, including 96 currently on the watch list. These numbers are all concerning, but there is some good news today. As you just heard, the first phase of vaccine distribution will focus on immunizing a number of key priority groups. I would like to provide some additional context on why it's important to prioritize these people. As with all of our public health recommendations and measures, our goals throughout this pandemic have been to protect the overall health of Albertans and to prevent our healthcare system from being overwhelmed. It's with these goals in mind, and as always, taking an evidence-based approach, that we are initially focusing on Albertans who are at the highest risk of severe outcomes from the virus, or those who have critical roles in healthcare service delivery. We know that long-term care residents and those who care for them have shouldered a heavy burden throughout this pandemic. To date, there have been more than 3,100 cases in long-term care facilities and supportive living sites. And sadly, 64% of our reported deaths have been from among these Albertans. We also know that when healthcare workers are exposed to or contract COVID-19, they are out of the workforce until they are well or their isolation period ends, and of course their own health is put at risk. By focusing on first immunizing these groups, we will reduce some of the demand on our acute care health system. We will also help to safeguard our workforce of critical healthcare workers and help prevent outbreaks which can lead to uncontrolled spread. Most importantly, we will help to protect the most vulnerable citizens in our province and support protection of our acute care health system so that all Albertans can access care. I know the prospect of a vaccine is promising, and this news provides a sense of relief and hope to many, including me. While we plan for this hopeful intervention, we can't lose sight of the tremendous challenge that's in front of us today: rising case numbers and increased hospitalizations. The first two vaccines we anticipate receiving both need 2 doses to be effective, with the second dose coming 3 to 4 weeks after the first. This means that full protection will take time to achieve, even for those who are getting it first. Because of this, and because it will take many months to protect all vulnerable Albertans, we must continue to work together over the coming months to keep our numbers down until enough Albertans have received their full series of vaccine to keep COVID under control.
Obviously, all of this planning is predicated on regulatory approval by Health Canada. The federal government has provided repeated assurances of an accelerated approval process where there have been applications. I believe that Moderna and Pfizer are filing their applications for accelerated approval across the world throughout the past few days. And so the Government of Canada has, which on behalf of the provinces, has agreed to use federal purchasing power to coordinate procurement. They have given us repeated assurances to expect our first doses by January the 5th. We hope, best case scenario, that we might actually receive some before then, but we're not going to count on that. So we are basing our planning on the assurances that we are receiving, and I think there are solid grounds on which to have this hope of federal Health Canada authorization and distribution by the pharma producers because of the initial trials. You know, both the Moderna and the Pfizer products have in their trials proven over 90% effective. In fact, I believe that out of 30,000 people who participated in the Moderna trial, that only 11 who received the 2 doses of the vaccine subsequently became symptomatic of COVID, and none of them with severe symptoms, as opposed to, I think, about 150 who became symptomatic of COVID in the placebo group. So that's a very high level of effectiveness, and we hope and expect that will be validated by Health Canada through their approvals.